This week, we had a very interesting case of a patient who came in because she reported an unpleasant sensation in her mouth, a discomfort that moved from a high level of pain to a slightly lower level. The detail in this case is that the patient undertook an empirical intervention. What is an empirical intervention? When a patient has some problem in their mouth or a general health issue, and before consulting a doctor, specialist, or expert in the area, they go and search on Google or some internet platform or simply seek information independently without a specific search criterion or characterization of the lesion and find treatment options. Now, this patient, following these very general recommendations for situations that might not specifically apply to her case, ended up choosing an empirical treatment option. Why empirical? Because it's not certain what the exact problem or cause is in this case. Now she arrives with a treatment she found on the internet, went to the pharmacy, got the medication, and started therapy. When we set the appointment, there is already a change, a difference from what one might expect to find. One does not see the lesions that might tell a story. There's always a timeline that guides us on the evolution of the lesion. Sometimes it's better to get to the consultation as soon as possible to evaluate the case and thus choose the best therapeutic alternative for each patient. The patient leaves with a previous treatment established based on the clinical characteristics and the appearance she describes, and she will be reevaluated in 2 weeks to then perform a biopsy to see what is happening at the tissue level. Taking a biopsy on inflamed tissue always results in detecting cellular proliferation of an acute or chronic inflammatory response, depending on the case, rather than when the lesion is obviously controlled. But there are cellular changes that, although they may look superficially fine, can be noted at different strata of the epithelium and even the connective tissue of the oral mucosa. So, it's always important that we advise a patient that if something appears in their mouth, any alteration or change, if there is pain and often it's something inexplicable, before starting an empirical treatment that they saw on the internet, it's ideal to get to the dental consultation and in this way be able to establish a treatment plan that is especially tailored to their particular needs. Because there can be many situations, but cases are independent and particularities are specific to each patient. So remember, dentistry is more than just teeth.